Hi dear doctors, welcome to the class of Kidscovery. This is a pediatric initiative by me. I am your pediatric faculty, Dr. Parv, and let's understand about the pediatric infectious disease that is called as mumps. So can you see this? Can you see this is the location of your parotid gland. So this is actually the parotitis which has happened, okay? And mumps has this beautiful feature of parotitis, okay? So the name of the disease is mumps. The type of virus is single-stranded negative sense RNA virus. I hope your microbiology faculty have taught you this single-stranded negative sense RNA virus. So can you see mumps is not very dominating, है ना? It's not dominating. That means it's not double-stranded. It's not positive. It's not DNA. It's okay. So you can remember like this. Now mumps belongs to Paramyxoviridae. So how to remember? M for P for M for. So mumps is having a Paramyxoviridae and the primary site of infection is upper respiratory tract and the mode of transmission is also respiratory droplets. So you understand now that if it is in upper respiratory tract, the spread is going to be via droplets, but in human body how it's going to spread? So from your respiratory tract it is going to go into the hematogenous route, in the blood it is going to go and then it is going to affect the parotid gland, the testis, ovaries and meninges, okay? So PTM are the three locations of mumps. So M for meninges, T for testis, ovary and P for parotid gland. So mumps is going to take approximately 18 to 21 days as an incubation period. So from mumps you can remember mum, okay? From mumps you can remember mum, and mum is a 3-letter word, so 3 weeks you can remember, 3 weeks. Coming on to prodromal symptoms, of course, the parotid gland swelling and tenderness is the hallmark feature, but since it's an infectious disease, it's going to have fever, malaise, loss of appetite also. So how will you diagnose it? So the clinical diagnosis, of course, if not, then virus isolation can be done in the cell culture. So what is the treatment? So you're supposed to give a supportive care only. And how will you prevent? So we can prevent with the help of MMR vaccine, that is measles, mumps and rubella. Measles, mumps and rubella, okay? Immunity. So once once the child encounters infection, there is going to be lifelong immunity. Once the child is having vaccination, he or she is going to have a lifelong immunity. What are the major complications? Of course, there will be meningitis and orchitis which is going to be there, and orchitis happens in a post-pubertal males. Post-pubertal males, orchitis can happen, meningitis can happen, and please remember, if both the testes are involved, it can even cause sterility. And one important thing which you have to understand is like why there is sterility. Why? Because there is a pressure necrosis of the spermatocytes. So there is an inflammation on the testicles that is going to cause the pressure on the spermatocytes, and spermatocytes are going to be under pressure. Why? Because there is a non-expanding tunica albuginea. So mumps meningitis, of course, it's a benign disease, it's a self-limited disease, and usually it occurs without any residual defects, but it's okay, it's benign and self-limiting. And neurological complications, others can be encephalitis, Guillain-Barré syndrome, transverse myelitis, deafness, all these things can occur, okay? So please just remember encephalitis, of course, because mumps can even cause the meninges, and from meninges, what can happen? It can even go to the ear, it can go to the brain, it can go to the GBS, it can cause the transverse myelitis also, okay? So these are actually the important parts, important things which you have to understand. And I'll leave you with a question like MMR has got measles, has got mumps, has got rubella. So can you tell me what all vaccine stains do they have? Okay, what all vaccine stains do they have? Like which vaccine stain is there in measles, which is there in mumps, and which is there in rubella? Just let me know in the comment section below. Thank you so much for watching and God bless you.